Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
The forms down, and when it reaches the colon, it becomes a probiotic, but a prebiotic. And any of you heard of psyllium husks? Well, that's what they recommend is a supplement that helps you keep your GI tract going. But I think a lot of fiber will do something very similar. Then the number 8 is get a natural light in the morning to enjoy the sun. Try getting out to exercise in the morning if it's possible. That's something that is a good idea. I don't know how many of us actually bask in the sunlight in the daytime. Perhaps in the summer, I don't know about the wintertime. Then number 9, eat anti-inflammatory foods. It's interesting. We talk about that often, the fact that vegetables and beans and vegetables and fruits are and sometimes fish give you the fiber that goes along with the anti-inflammatory foods that really help your immune system grow and protect you from the infections that cause us to have all kinds of diseases. So, but I guess we've talked about eating anti-inflammatory foods forever, I guess. I think the one thing that I don't know if we don't talk much about brown rice, although I think that's something that we used to talk about a while ago. Beans we always talk about, and vegetables and fruits. Sometimes we don't talk as much about sweet potatoes and their value as well. But anyway, so eating those anti-inflammatory foods is an important aspect of a healthy diet. Any comments, additional comments?
Yeah, my comment would be there's a slogan that says eat the rainbow. And what it's talking about is eat brightly colored fruits and vegetables. They're called phytonutrients and they're high in antioxidants. So, seem like red fruits, tomatoes, watermelons, strawberries, red peppers, orange, yellow, carrots, pumpkins, sweet potatoes, oranges, pineapples, greens, the dark green leafy vegetables, blue, purple, plums, blueberries, eggplant, white, brown, onions, garlic, cauliflower, mushrooms. So you eat the rainbow, and that'll get what we're looking for here.
Thank you for those comments. And then finally, it's interesting because there's a number of articles we will read today that talk about drink coffee. Coffee consumption has been linked to a lower risk of many diseases, including cardiovascular disease. And so they particularly talk about filtered coffee. It's interesting how coffee, which is almost seems addictive to the American population, is recommended as a healthy drink nowadays. There are many articles suggesting that it plays a role in lowering mortality and deaths from cardiovascular disease and other diseases. Any thoughts or comments about that, about coffee? It's interesting. I don't. I drink coffee only when it's cold. How many of you are coffee drinkers?
I do. I drink coffee.
Hmm.
I do. I drink coffee, Cecilia. I think this whole thing just keeps Starbucks in business.
Yeah.
Well, there are more articles now. It's funny because many Starbucks are closing, but
Hmm.
the number of articles these days that are suggesting that coffee is very healthy. Hmm. Shocking. I thought about that as well, but
Yeah, I think Starbucks will do like everybody else, file bankruptcy, then come on back again.
Mm.
Well, money's tight. People can't afford a $7 cup of coffee.
Absolutely. It's expensive. Yeah.
But they're buying it. They're buying it.
and they
Fewer
also
people are buying it. That's why stores are closing.
that's why
Yeah.
they're closing it, right?
Mm.
I was shocked because I thought that was the one place that would always be open.
McDonald's coffee's just as good,
Hmm.
and Dunkin' Donut.
Okay. Yeah, it's interesting to me. Coffee is coffee. I
Yeah.
didn't know. I haven't eaten enough coffee to know the difference. I think there are coffee lovers who demand a certain type of coffee. Uh, are any of you real coffee lovers?
Lover. I'm going to have a cup in a minute. Am I a lover? I'm looking at it right now.
I, I just had a cup, but it's decaf, and some people don't consider that coffee.
That's right.
And I know that decaf does have a little bit of caffeine in it.
Hmm. Yeah.
But for women, they tell us not to have caffeine. Too much caffeine is not good for women, particularly
Hmm.
menopausal women, because it can bring back the hot flash. But it's good, Janice, before you go to bed, drink a cup of coffee so your feet will be warm.
No, that doesn't sound too good. It's only good in the morning, and most of the time it's only on weekends. But
Oh,
because we sit here on Thursdays, I will put on a pot of coffee. Don't get it right away, but in a little while I'll get up and get a cup. I try not to drink too much.
Well, don't forget as you're sitting to do your repeated exercises to keep the circulation in your legs going,
Oh, good.
because they say that sitting is the new smoking. So keep your repeated exercises and your feet, keeping that circulation going all the time.
I need that because I have varicose veins.
Yeah.
Uh,
Then
the
the
best
next
coffee in the world is
what'd you
best
say?
coffee.
What'd you say, Darryl?
Best coffee in the world is coffee with bat guano, bat droppings, but it's not actually from the droppings of the bat, but the bats spit on the coffee beans, and it creates. It's called bat spit coffee, and it creates a unique, naturally sweet, low-acid floral flavor from enzymatic changes, and so it's not as bitter as the coffee that we drink in America, and it's popular if you go to Costa Rica and Madagascar. It's the best coffee in the world. Ask for bat guano coffee.
Hmm.
I'll pass.
Now, what about mushroom? Darryl, what about mushroom coffee? Have you heard of that?
Yeah, but the guano coffee is, according to Google, is better.
Mhm.
what's mushroom coffee?
I just see it on the internet, people drinking mushroom coffee.
Mhm.
I don't know. I've never tried it. Brined up mushrooms. I don't.
No. Find
It's
up
supposed.
mushroom is mushroom soup.
Yeah.
I don't know.
Mhm.
Just tell you what I see.
That's
Mhm.
interesting. The final article that I would share with you before we go articles is 5 things that super ages taught us about longevity last year. And the first thing is something that I guess we talk about on this session every time we meet, is choosing the right foods, uh, and recognizing the danger of ultra processed foods and the importance of eating the rainbow foods, as Darryl had talked about, becomes essential. They mentioned Maria Morera, who was 117, years when she died last in 2024. And she spent most of her time with the Mediterranean diet and three plain yogurts a day, as well as fish and olive oil. So uh, choosing the right food goes a long way in helping you achieve longevity. And then trying to be consistent in your workouts. Talk about 92-year-old lady who really started workouts at 77 and continued and set many world records for runs that she started much later in her life. And then another lady started at 7:35. And exercise is thought to be the one of the few interventions that has shown any effect on slowing the body-wide aging clock. So that plus we are reading more and more about omega also doing something similar when it's combined with exercise and eating the right foods. So that was the second thing. The third was connect with others and have a little fun. Social interactions are essential for human beings, and isolation is not good. And having a good life is really about stringing together as many positive activities as you can with as many people that help you feel better. So social interactions, such as we're having today, is thought to be contributing to longevity. Number 4, they mentioned don't fear setbacks. Well, I guess if you feared setbacks, you'd never do anything because uh, setbacks are what set you up for your greatest achievements in life. So don't let setbacks or falls stop you from moving forward and trying to achieve good health. And whether you're 80 or 90, exercise, diet, and good sleep habits will allow you to live a qualitative, healthy life. For many, I mean, everybody isn't that blessed. Any comments about the setbacks? I guess I don't know anybody who's not had setbacks, so it's just like in order to excel, you have to learn from the mistakes you make in life and not repeat them. So setups are setups for you becoming stronger than ever. And then finally, number 5 is keep a positive attitude. And it talks about this 101-year-old gentleman who at 5 was struck by a car, heart attack at 39, triple bypass it, and mitral valve repair at 89. And despite all that, he's 101 and still going strong. So those are some of the things that I thought we could reflect on as we start the 2026. Any additional comments you want to make about any of the things we've talked about so far?
I have something I wanted to share, Dr. Callender, not about that. But the last time we met, I mentioned that my granddaughter, Kayla, had a friend at school who had end stage kidney disease. And Kayla was trying to talk her into sitting on our sessions. But this morning, as we speak, she's getting a kidney transplant.
Wow.
She's at GW Hospital. So Kayla called me last night. She's really excited about it. So hopefully everything's going well.
Oh, that's wonderful. That's great
Yeah.
news.
It is. Yeah.
Yeah, yeah.
Mhm.
Oh, well, thank you for sharing.
Yeah.
Well, I guess if there's no more additional comments, we can start the articles. I see Dr. Perez is with us. Welcome. Happy New Year to you.
Happy New Year, family. God is good and faithful.
Happy New Year.
I've missed you. Just seeing your faces is warming my heart. Thank you.
Good, good. We're so glad to see you as well. Forever chemicals is something that we've talked about before, and we'll continue to talk about it because they now are linking this to multiple sclerosis, as if we needed to have more diseases associated with the plastics and the other forever chemicals. But now they've identified that multiple sclerosis is not infrequently associated with a high percentage of body containing these plastic forever chemicals. Unfortunately, one of the things that we haven't really done well is to talk about how do we get rid of these forever chemicals once they're in your body. And that's a target for, I think, what we're going to, for the future. Yes, you try to minimize forever chemicals, but in all honesty, it may well be too late for that because we have already, most of the tests of all human beings across the globe have demonstrated that these forever chemicals are deeply intertwined in us. I remember one of the things that John Buchanan talked about was the fact that the fish eat the forever chemicals in the water, and then we eat the fish, and we have the forever chemicals as well. So I think much of the future will have to be addressing how do we rid our bodies of these forever chemicals, which are almost ever present. Because we've just recognized their presence, but it may be too much, too little, too late for many. So, but it's good to know that at least we are aware of it now, and that to the extent that it is possible, we should try to limit our exposure to these chemicals, although it almost seems too much too late. Any comments on other thoughts about these forever chemicals that we started doing to make life easier, but they, in some ways, have made life shorter? Any other comments about these forever chemicals? And okay, well, we can go to the next article then. That was one. The second article is about the different yoga poses that they identify 6 simple poses for yoga beginners. John Buchanan talked about yoga an awful lot, and some of you may be fans of yoga and the fact that it is associated with healthy practices and is recommended. And all of the tests that we've done demonstrate that yoga is healthy and beneficial. Any comments about yoga and how the posturing can be beneficial? Over the last 20 years, many of the additional scientific studies have demonstrated the value of yoga and the breathing and other postures that are helpful. There are no other comments. We can go to the next article. And this is an interesting article. It talks about the fact that RFK Jr. Felt that there was an article that did not identify vaccines association with autism. And he wanted the study to be retracted. The Annals of Internal Medicine resisted his request for the article being retracted. He has long felt that vaccines are partly responsible for autism, although there's no scientific data to support that contention. And so that's another example of his efforts to foster his opinions on us, whether or not there is scientific evidence to go along with it. Any comments about his quest to link autism with vaccines, which the scientific bodies are not do not agree with his contention? There's so many variations on a theme of autism. It's kind of disturbing that he persists in this, although he and Trump are two of a kind. Any comments about autism? Do any of you interact with people who are autistic?
Yes, a friend of Sonia and I has an adult son who's always been autistic, and so he's not very well socialized.
Yeah, it's interesting how there's a number of athletes who are autistic, and so autism manifests itself in so many different ways that sometimes it's difficult. Dolores, can't hear you. You're mute. You're mute. Can't hear you.
You're muted,
We can't hear
Dolores.
you. We can't hear you.
Okay, you can hear me?
Now we can hear you.
I have an autistic child who is 43, I think. But with his autism, I took him to Children's Hospital because they had this system, and they did some blood tests and everything. And he came out, his autism was 16Q. I forgot the thing, been a while. So it's been hard, but we made it so far with God help.
He's 40 years old, huh?
He's 43. Yeah.
Oh, okay. All right. Any other comments about autistic children?
Yes, I have an autistic cousin, and the parents were in their 40s when they had him. And then I went and studied about it because I worked with autistic children in the classroom, even in high school. And it's a wide spectrum, it's a wide range from where they cannot be diaper changed until they're functional or a genius in one perspective, like a genius in mathematics or music and socialization. There's that common link among all of them where there can be socialized. And one time I went to an autistic luncheon where that was my first time being there. No one had trained me, where I was with a group of autistic young adults to adults, and not knowing what, I was sort of fearful at first, but then I got acclimated to it and learned that each one are different. but it is a different range. A lot of people label children that even that are mentally retarded or etc. as autistic, but they're not. There's certain definition for them being autistic.
That's true.
And they'll just point and say you're autistic or something like that, but they're not. And one time I was teaching a piano class and group piano class in high school, and they didn't let me see the IEP, and it was an autistic boy, and he was the sound of an A, for instance, would send his a nervous system into a frenzy, and he would have conniptions, and his dedicated aide, which was around him, didn't know it. And then if I said shh like that, that would also send his nervous system into a frenzy. But as far as learning the piano and etc., he could do it. So I just learned there's a lot of things. They don't always tell you what will set them off or what they like, whether they like just looking at pictures or books or reading. So it's when they're finding out more and more about autistic, but people, the general public really don't know.
Yeah, it's as you mentioned, it's a wide spectrum. Dr. Perez, you had a comment? I guess she
Yeah, I've got a comment, and I apologize. I can't find where to raise my hand in the Zoom because when I'm showing the slides, that control seems to disappear, or I can't find it. But Kennedy is going for a 2-for-1. The conspiracy theories say that all vaccines produce autism with children, and his second thing that he's going for is where I've got it highlighted. He's got a problem with aluminum because there's a conspiracy theory or myth that says aluminum causes Alzheimer's and dementia. And there's no convincing scientific evidence that exposure to aluminum, including aluminum foil, causes Alzheimer's disease or dementia. So they've got aluminum with the vaccines because that helps the vaccine be absorbed better in the patient. It's more effective when the vaccines include the aluminum, and so he's going for both. He's anti-aluminum, including aluminum foil. That's where most of the conspiracy theories come from, and he's trying to tie that into autism.
Yeah. Okay. Dolores, do you have any more comments to make?
Yeah, my child was considered autism until, well, he still is, but he had a chromosome. It's been a long time. I'm trying to remember, but he had an extra chromosome, and
okay.
that was his thing. But for a long time, he was considered autism. But a doctor told me to take him to Children's Hospital because they have this database of all these autistic children and see what category he go in. And that's when we found out that he had an extra chromosome.
Okay, well, thank you for sharing. That's interesting how the wide spectrum of autism, some are geniuses and some are just the opposite. So it's such a wide range. The next article it talks about the new recommendations for COVID, chickenpox and measles, mumps, and rubella. And it's interesting the way that Kennedy has reformed the CDC and how he's made changes which minimize the inclusion of physicians and scientists. But what this does is make it actually more difficult to get COVID shots and measles, mumps, and chickenpox vaccines without getting physician involvement. And some think that this increases vaccine hesitancy, and that this is one of the reasons why the number of people who are vaccinated has decreased and continues to decrease. And so this is the antithesis of what the scientists in the medical field feels is desirable. And so some of the practices that he's gone through and the people he's eliminated many physicians from participating in these advisory groups, and how this will play out and how this will affect our health, and how we combat diseases for the rest of the next 50 years will be interesting to see. But it's clear that his position and Trump's position is such that most people think we're going backwards rather than forwards. But time will tell. And one thing is clear, that the one thing it does build is distrust for the validity of the scientific method. And that's something that whether we like it or not, that's part of what has happened with the new administration. In addition to the way in which they handle many issues being different, the way they handle health issues is different as well. Any comments about this? Now let's go to the next article. This is the article that talks about omega-3 when combined with exercise and the proper diet will actually decrease biological aging by 4 months, which seems kind of short, but it's better than nothing. And the omega-3 plus the exercise, the vitamins, is something that to define something that slows the aging process is something that is desirable. Dark chocolate is another ingredient that has a lot of omega-3 as well. And, 4 months of slowing aging seems minuscule, but what are your thoughts about it? Darryl, you have any comments?
Yeah. Of course, fish oil. That's what people go to for omega-3 or fatty fish. But me being a vegan, I don't do either one. So what I do is nori, that's seaweed, and spirulina. Um, let's see, if anybody's a fan of Chinese food, if you get vegetable rolls, it'll be wrapped in nori, and they're really delicious. And like most Chinese food restaurants, their prices are very affordable. So uh, you can get a couple of orders of vegetable rolls or sushi at a Chinese restaurant, vegetable sushi, and that's an easy way to get omega-3, and you get it where the fish get it, and it's stronger in nori than it is in fish oil.
Darryl?
I'm amazed. How do you measure 3.8 months of age? What tool, mathematical, and then they said over 3 years slow biological aging. So I could take a test and see if I'm really aging at the right speed or if it's being slowed down.
Yeah, well, they don't go into detail to let you know exactly how they uh, modulated the epigenetic clock, but uh, the number of participants is only 777 participants in Switzerland, so that the number is not persuasive, but it's a start of something. Uh, 4 months seems awfully short to me, but it's food
Well,
for thought.
most
Any
of
other?
these scientific and medical articles have been peer reviewed, right?
What was that now?
Is this a study that you think has been peer reviewed?
I don't think so. I think the
Oh,
number is so small that uh, that's a start of something. But that number is, and it's only one location in Switzerland, so that it would need to be repeated by a number of different locations. So I think it's a beginning study. They need to be studied in other locations.
okay. Well, anecdotally, I love that word. The longest living people in the world are in Japan, and they eat plenty of seaweed and fish oil, and they live longer than anybody else. So take that for the 4 months.
Any other comments?
Fish oil, um, and omega 3s, especially in a lot of old-fashioned West Indian households, as cod liver oil with a follow-up with some orange juice when I became an adult. I mean, right now, as I am telling you this story, I can see the bathroom that we all would go to try and get rid of it. But my mother and all the mothers I knew gave a big tablespoon of cod liver oil,
Oh man,
uh,
yeah,
orange juice chaser.
yeah, I remember.
Mhm.
I hated it. Yeah,
That might be why we're still here.
maybe in spite of it, we're still here. uh, yeah, castor oil and cod liver oil. Yeah. Okay, well, let's go to the next article and see what this. This is a fungus that Candida auris, which is a new, relatively recent fungus that is bothersome because it's resistant to most of the antifungal agents. And so if you get an infection like this, uh, it's not easily treatable. And so the best thing to do is to avoid it and also to try to find new antimicrobial agents that will destroy it because according to this article, half of the people who get this fungal infection actually die from it. So it's a new antifungal, a new fungus that is lethal in many situations because it doesn't respond to the antifungal agents that we have. So trying to stay as clean as possible and as immunologically strong is very desirable, and also washing your hands frequently becomes something that's important to do. The next article is the one that talks about whether or not you need another measles shot. And this is a good article that looks at the uh, efficacy of two measles shots, indicating that two measles shots is 97% effective, uh, except there was a time period during which inactivated measles was used as an injection. And it says that if you've gotten two measles injections, that you probably don't need um, uh, any additional measles shots. But if you only got one, or if you got it in the 60s when inactivated measles was used as a vaccine, that you may need another dose. It's quite clear that the measles is one of the most contagious viruses there is, and that if you're not vaccinated, it likely will uh, cause you to get sick and may kill you. So we're having more measles now than ever before, partly because people are not being vaccinated or we're not vaccinated. So this is a new concern for us. Measles had been completely eliminated, but now because of the resistance to vaccines, it's becoming uh, present again, from zero to now more than 500 cases identified. And then, as we mentioned earlier, the CDC is now modifying who receives the measles mumps vaccine and at what age they receive it. So we're in a new era now that is going to be associated with more infections. But there's a test that they can do to identify whether your immune system is capable of resisting measles. And if the laboratory tests shows that you're not immune, they can give you the a vaccine, which is still effective. And it talks about an age, if you got a vaccine in the 60s, that you may need a second vaccine.
Can you get that lab test?
Particularly if you're in an area where measles is cropping up. What'd you say, Darryl?
Can you get the lab test as part of your annual physical?
I think you'd have to specifically ask for it.
Okay,
I
because
think
I'm
you
in
and your
that group.
doctor would talk about it, and then you'd have to ask him to get that test for you to test your immunity if you're in an area where measles is now cropped up.
Okay.
If you're not in an
I hi-
area where there's measles, then it probably isn't necessary.
yeah, I highlighted the part of the article that says that people born before 1957 are likely to be immune,
Right.
but that's if you've got the records to support the immunizations. Um, Carol says we were vaccinated, but I don't remember.
Well, that's right. I guess if there's any question about it, then and you're in an area where measles is active, then it would be important to get that immune test. Dr. Perez?
So many of the old timers, like me, had measles.
Which is the best vaccination.
Right. I remember all my cousins, whoever got it, all the children were put together so that we'd all get it. And only one set of parents had to stay home.
It's amazing the things we did, huh? Yeah. Okay. It's food for thought for those who or in an area where measles has resurfaced. Fortunately, in our area, it has not resurfaced. I don't know about Chicago, though. I doubt that Chicago has, Illinois has a measles problem yet, but I don't know. This is an interesting article that talks more about the drinking coffee and reducing cardiovascular deaths, and that the morning coffee drinkers are better off than anybody else. And the fact that it's the cardiovascular reduction of deaths that really factors in. Although this article points out that apparently the more coffee you drink, the less likely you are to die from cardiovascular disease. So drinking coffee, which is once thought to be a tremendous addiction, now is being thought to be a good practice for your health. Interesting how times change.
Nothing stay the same.
Yeah.
Is this suggesting that more than one cup of coffee doesn't has a higher mortality, or what is that saying? Is it better to have one or more cups of coffee?
It's sounds like it's better to have more than one cup of coffee.
Mm.
Although the p-values aren't that impressive.
And Chicago did have a measles outbreak in 2025.
They did. Oh,
Yes.
wow. Well, then
So
you
I'm gonna get
need
my
to,
test.
yeah, you need to get that test. So far, we haven't had that here in DC yet. So we shall see. This next article talks about the fact we now have an oral GPL semaglutide, that's a new GLP-1 drug that is now oral. Remember, initially the GLP-1s were by injection only, and now we got to the point where we have a significantly high oral dose that you can take once a day that is as effective at weight reduction as it is as treatment for diabetes. So this is a change so that those people who didn't like the injections can take the oral medication and get the same result. As we mentioned on many occasions, the GLP-1 drugs are affecting so many different organ systems that it's going to be interesting over the next year or so to see what this wonder drug does. Also, recognizing that the more we use the drug, the more we become familiar with its side effects as well as its benefits. So far, there's very few organ systems that have not benefited by the use of the GLP-1 drugs. So we shall see as time goes on. There's a number of research efforts that are involving looking at the GLP-1 drugs and how they interact with different ethnic groups. This is something that Dr. Perez had suggested about a year ago that people are paying attention to. One of the things that this article is talking about is the fact that GLP-1 drugs were first approved only for diabetes. Then they became approved for weight management. And so now we've got a situation where it's approved for both weight management as well as diabetes. And so this caused quite a problem for diabetics because it made it unavailable for some diabetics because so many people are using it for weight gain. But that problem has been resolved. Any other comments about the GLP-1 drugs and the new oral medication that is now approved for use?
Well, if I'm reading this correctly, uh, the only way of drug usage for type 2 diabetes right now is currently injections, but the FDA is awaiting, Eli Lilly is waiting on a decision from the FDA about the first oral GLP-1 for type 2 diabetes. It's going to be orforglipron. Am I reading that correctly?
Yeah, I think you are. I think that the injection is the drug that all of the initial research was done on, and the oral drugs is a relatively new commodity, uh, particularly for diabetes. So right now, yes, it is approved for the injection is approved for diabetes. The oral is approved for obesity. Dr. Perez?
It seems like the GLP-1s are putting us in a posture that we were in as it related to HIV disease, in that given the time that they have the patent versus the time that they begin to compete with their own drug for profit, we see a slowdown in production. I expect to see the GLP-1s will be used significantly with addictive disease, especially associated with alcohol. So we have these drugs that come out, and during that 15-year, or I don't know if it's been reduced, but it used to be a 15-year period of time, that you don't want to compete with yourself. And it slows down the progression of science. Was
Well,
that clear?
well, I don't. It's interesting that you would say it slows down production science. I think it's. I think it's a really commercial issue because you have the rights to that drug for a certain period of time, and then after that, everybody can compete. But in the time when you are no one is able to compete with you, that's the time when it becomes commercially advantage that they can make most of their money. So that for the first 5 to 10 years, they make a lot of money, and then after that becomes competitive. The comment you make relative that how that slows down the advance of science is interesting observation, and I guess the question is which is more important to us, the commercial advantage or the scientific advantage. And it's clear to me that the commercial situation has taken precedence.
And I guess the agreed. and prayerfully the global issue, making sure that when we have scientific advances, that those advances then become available to
Well,
all.
that's unlikely to occur with this administration.
Uh, that's why we got to get rid of this administration.
Well,
That's a comment for another another session. But
yeah, well, well, you've got a situation where the president and the RFK are running the show. So as long as they are in power, uh, we are going backwards rather than forwards, it seems to me. But they consider that going forward.
There's other things that's hard to get rid of, like roaches and bed bugs.
Any other comments about the GLP-1 drugs and the use of for diabetes as well as for weight loss? The next article is about flu at the highest level in 15 years. Many thought that because of COVID and our use of masks and hand washing and other things, that we had such a low incidence of flu deaths and infections that we were going to have a new era of flu. And instead, we've got more flu deaths and hospitalizations than we've had in 15 years because we have reverted back to our previous practices. And we can see that the number of deaths and hospitalizations has reached a new high, and some part of it is related to the vaccine hesitancy as well. And another part of it is maybe related to the efficacy of the flu vaccine, but we haven't seen data that tells us about the efficacy of the flu vaccine in terms of preventing hospitalizations and mortalities. With this new CDC, it's a little slower to actually show forth whatever efficacy the vaccine has. In the past, 50% help was what you looked for, at least. But I haven't seen any data that talks about the efficacy of the vaccine. And it may just be that it's slower to come by with the new advisory committee. I don't know. We shall see. Any thoughts or comments about the fact that we are having a new high for deaths and hospitalization for flu?
Yeah, I'd love to see a study to see whether flu vaccinations are down. You know, a lot of people are
they are.
vaccination. Yeah,
They are
they're
down, but
resist. Yeah,
the
okay.
question is that cause and effect?
Mhm.
That's the question. Are they related, or because you have to look and see what percentage of the people who are hospitalized and die have been vaccinated, and that's the data that so far no one is sharing.
Yeah, in the Chicago music community, a lot of the performers over December and January have the flu, and so there's been an awful lot of cancellations, and most of these performers are unvaccinated. Um, and
You
I've,
said are
you know,
unvaccinated?
unvaccinated, right? Um, so, you know, like my wife got the flu. She's still struggling with it after a couple of weeks. Uh, I didn't catch it. I had the vaccination. She didn't have the vaccination.
Mm. Yeah. Well, it's interesting because we still haven't seen any data on the uh, efficacy of the vaccine and the difference of the responses of those who are vaccinated versus those who are not vaccinated. I think that data would be helpful, but we haven't seen it yet. Dr. Perez?
Will we ever see it?
Yeah.
I mean, you look who's in charge. I mean, years ago, the things that we are seeing now in Chicago with measles, with the flu, this secretary would have been sent away shamefully. The epidemiologists in the CDC, they're gone. People who were passionate about this will never work for the government again. And the world doesn't trust us. So what's ever happening globally, we have destroyed many of those connections and those networks. This
Yeah.
is terrible.
Well, your screaming isn't going to help. What we need is a change in the administration. Yeah. Do we need to vote those people out? That's critical. Of course, we won't even talk about the other things that happened in terms of going to another country and kidnapping the president. I mean, we're in a new era.
Don't get me started. Don't get me started.
Okay.
You talk about screaming. Oh my goodness, don't get me started.
Okay, we won't. All right. The next article is an article that we shared with our church, and we've talked about it today already, about foods that fight the flu. And you see a long list here. We've actually talked about this already. Darryl talked about his laundry list, included everything that's here, with the sweet potatoes, the berries, the beans. Beans are often neglected in the fact that they contain zinc, which helps. And so many times, Darryl has talked about these foods. Of course, he's not mentioned the salmon because he's a vegan, but all the rest of them are part and parcel of things that help fight the flu. So, but of course, as always, it's not food alone. It's the diet, exercise, and meditation as well that helps us to fight off the flu. Any comments about the things that were mentioned out? Any comments about this list of? Okay, Carol?
Yes, this last strand of flu, and that's what John succumbed to. Have they given it a name yet? It's a new strand of flu.
Not that I know of. I know that it's A and B is the only term that I've heard of. They haven't given it a new name, as far as I know. Lucy, you know anything? I haven't seen. I guess with this new administration,
That's right.
getting information is difficult. That's all I can say. Yeah, it's
I
difficult.
know there were some articles in the newspaper and something saying that the influx of this different strand of flu is going around, but I haven't read anything about you know, if people are actually dying from it, or are they taking statistics of what's happening with this new strand of flu?
No, they're dying. They're dying and they're hospitalized. However, the quantification of it is not clear because that we haven't seen any data that reflects uh, the comments in terms of exactly how many people are hospitalized, uh, what percentage of them are vaccinated, what aren't. Those are data that we used to have in the past, but we haven't gotten yet. And it's January, so we would expect that since the flu is killing more people and hospitalizing more people than ever before, that we should get some information about that, but we haven't gotten it yet. So maybe in the next week it'll be here.
I'm looking at AI overview, and it says, yes, the current dominant flu strain for the 25-26 season has a name, influenza A H3N2 subclade K, often nicknamed the superflu.
Yeah. So I'm hopeful that over the next couple of weeks we will get some more information to identify whether the vaccine is helping or not. But it's not clear yet. Okay. The next article shows that medical groups have been barred from the CDC vaccine discussions, which is disturbing, but not unexpected. And the one that follows that shows that that Kennedy has particularly eliminated medical groups from the CDC advisory groups, feeling that they are troublesome rather than helpful. And so what impact this will have on the sharing of data remains to be seen. But one thing is clear, he has stacked the deck. Whether this is a good stacking or a bad stacking remains to be seen.
Bad.
But it's a stacking nonetheless.
So who is he putting on there?
Oh, he has the next article has a laundry list of people who he has identified who share his point of view. And I think he had 8 new people who he put on who he felt were experts and who were many of whom were anti-vaccination people.
So are they in science or medicine?
Some are, some aren't. Some are in science, and some aren't. He considers them as being experts. So, and from they're experts that share his point of view. That's the difference. Yeah.
Yeah.
And even nationally, the collection of data now is, almost red and blue. So there are states that will continue to keep the same vaccine protocol or schedule. And the important component of that is that they will pay for it. So,
Yeah.
like so many other things, this is targeting the people that are in a position not to compensate for the ignorance of the government. So yes, if your immunization schedule does not follow your state, then you have to pay out of pocket.
Yeah, that's the part of it that many people are not aware of. Yeah.
We no longer pay for Paxlovid if you are on Medicare. And therefore, you pick up that treatment. That's just an example because it's $700 and it hit me. But the immunizations for children that are no longer, I mean, we have put people who are residents of this country afraid to go to get immunized
Yeah.
because of ICE.
Yeah.
Are you kidding me?
No, it's lamentable. So we have to correct it politically by voting the way that changes things. Talking about it doesn't help. Voting about it does. And it's interesting. There's a number of articles that talk about what happens to those people who sued Kennedy and HHS. Some of them have been fired, and some haven't. So it's interesting to watch how these things end up. And this is just the second year of his administration. So just beginning the second year of his administration. So we got 2 more years of this.
Second year, second week. We haven't even gotten to Martin's birthday yet. Killing people, kidnapping people.
Yeah. Going to the next article. Okay. This is just an article that talks about how global seafood trade is different. Certain parts of the globe have a lot of plastic forever chemicals, and certain global parts have less. And it's kind of difficult to figure out how certain parts of the globe, parts of Asia and Oceania and Saudi Arabia and Thailand and others have higher concentrations than other places. And I'm not sure I understand why. Dal, did you figure it out? It's
No.
it's problematic, but it's interesting that the PFAS contamination is not the same everywhere, uh, and so it's gonna take a lot of scientific investigation to kind of figure out what we can do about reducing the PFSA contamination and failing to reduce it, how we can decrease its impact upon our health. But that's
Yeah,
we
my
got a long way to go.
investigation says just stop eating fish.
Yeah, yeah. As if, unfortunately, that's not the only way you get the PFAS contamination. So, but that's one way to do it. But then there's all the plastics that we associated with is another problematic source. So it's a tough situation. Tough situation. There's another article that has 6 tips on how to boost your immune system, which eat healthy foods, which we talked about, exercise regularly. It's interesting that they say stress less. How does one do that in this world, the United States today? If you have a lot of faith in God and believe that He is the supreme power, then you can stress less, and if you meditate more.
Um, yeah, meditate, and the news cycle is very repetitive. If you only take in the news once a week, that's enough, and it reduces stress.
Yeah, you're right. Yeah, yeah. Because not about 80% of the news is bad. And it's frightful and it's stressful. So decreasing your news information would be helpful. And of course, the yoga and the deep breathing. And then sometimes we don't appreciate the importance of 7 hours of sleep a night. Smoking speaks for itself, and so these are tips that we constantly share that may well be life-saving. So,
And I think the number one problem with the senior community and getting enough sleep is nocturia, getting up to pee at night. So when you're watching TV, which sitting in front of the tube, or whether it's a television or a computer, it disrupts your biorhythms. So watching TV at night, eating snacks that make you thirsty, and so you drink a lot of fluid at night to to tame your thirst. But then you get up 2 or 3 times a night to pee, so you get terrible sleep. So um, you know, I just recommend no snacking at night. Um, Last liquids before 6 a.m. I mean before 6 p.m. and minimize the TV and the computer, and you sleep like a baby. Of course, you get your exercise. That helps sleep too.
yeah. Thanks for sharing. Good points. Very good point. And then the question is, do we resume the frequent hand washing and masking as we get into as we're now in the midst of the flu season? Those things that we need to do as well. Okay. I guess we have time for maybe one more article. Oh, yeah. Well, I guess it's almost 10:30, but we've talked already about the fact that Kennedy has fired many NIH people, and he has the right to do that, and he's done it. And the whistleblower complaints have been fired as well, and the 8 new people that he's rehired is something that he's put in people who reflect his own perspective, which is his right to do as the NIH director, as the Secretary of Health, rather. So I think this would conclude the articles for today. Any closing comments?
Anybody who needs assistance getting registered to vote, going to vote, anything like that, please let me know.
Yeah, it's some of the things that have happened over the last week. Even those who thought about tyrants would never have imagined some of the things that have happened over the last week. But it's a good example of what we have to face. So,
Carol,
and
do you want to talk
that's why
about
Darryl's
final
point about
arrangements?
having less news is